Hi there, my name's McEwen. If you're watching this video, you're about to have a knee replacement. I want you to understand that my only concern is that you get the best knee possible as soon as possible. The program outlined below is designed to maximise return and minimise discomfort, and is put together purely for your benefit. You'll be given a lot of information around the time of your surgery, and it's very easy for the basic and important messages to be lost in all the detail. So I'm going to outline the basic and most important messages right now. There are only 4 things you need to remember. 1. Be totally invested in the outcome of your own surgery. My technical ability give you the possibility of getting a great knee replacement, but that can't be achieved without you working with me. And so the people who get the best knees as fast as possible, with the least interruption to their normal life, and the quickest return of function, are the people who are totally invested in guaranteeing that that's the outcome of their surgery. Number 2, swelling is your enemy. Swelling drives pain, swelling drives stiffness, and pain and swelling lead to poor outcomes after knee replacement. Now, swelling is driven by 2 things after knee surgery. One is gravity and one is overuse. Therefore, the way to treat a knee replacement is to have it up and elevated and not make it do too much. The converse, sitting, standing and walking for long periods, will guarantee swelling, put you on a path to pain and stiffness and a poor outcome from your surgery, and it really should be avoided at all costs. Number 3, sleep is important. Pain is a very complex thing, and it largely relates to emotional state. The best way known to derail your emotional state and your ability to manage post-operative pain is to become sleep deprived, or to produce normal sleep patterns immediately after a knee replacement. It is, however, possible to manage sleep to a point where you're able to cope with things. If you're having problems, it's important to let me know early on. Point number 4. It's very common to have bumps in the road after surgery. In the context of a knee replacement, you can have problems with the wound weeping, with pain, with sleep, with movement not progressing, the way you're walking. And it's very important that I know about the bump early rather than late. If you want a small bump, keep me involved. Let me know what's going on if there's a problem. If you need my input, there's only 2 numbers to ring. One is my office number to be used during in-hours. If it's after hours, use the joint hotline mobile phone number that will be in your discharge envelope. What follows now is detail on how to exercise your knee. You'll be shown how to do this before the surgery. You'll be shown the same exercises in hospital. You'll be practicing these at home. They'll be reinforced by the physio at your 2-week post-operative visit. Remember that the chance for you to get the best knee that you can, as fast as you can, will be determined by how well you look after this knee, including these exercises, in the first 2 weeks. Good luck.
I'm going to run through the rehab protocols now. It's important to understand that these exercises are put together to maximise your return and minimise discomfort. It's best that they're not altered and they're done as per the plan. Quality is much more important than quantity. It's important to do these exercises well, not to do them exhaustively. The patient who's kindly assisted with making this instructional video is 2 weeks down the track from bilateral simultaneous knee replacements. He's in this video because he's doing everything right, but he's not the best, he's not the worst. He's a good representative of where I expect most people to be at around the 2-week mark. The aim of this exercise is to achieve a powerful and sustained contraction of the VMO muscle. Full extension and VMO control is critical for a normal gait pattern. the part of the quadriceps muscle closest to the patella is contracted and held so the knee is pushed down into the bed. The straight leg raise is added in as a further exercise for the VMO once the static quadricep exercise is being done effectively. If you can only do a straight leg raise as a bent leg raise, hold off until you can do it properly. The exercise begins with the static quadricep contraction. With the contraction held, the leg is lifted off the bed and held for 10 seconds. Now it's important to understand how human tissue behaves when you're trying to stretch it. All of our tissues are viscoelastic. Now what that means is the more rapidly you apply a force to it, the more rigidly it will behave. Now we want your tissues to behave in a plastic way, not a rigid way, and to stretch, not be rigid. Now that means you've got to apply a force slowly and give the tissue time to stretch. And research has shown that 20 seconds is the correct time to apply a stretch to the sort of tissue we're trying to manipulate around a knee replacement. So you'll see that all the stretching exercises that follow involve 6 increments of 20-second stretches, and it's important to understand that the dose we're stretching isn't how much you're hurting yourself, it's how long you're holding the stretch for. So start the first stretch at a level that's tolerable, hold it for 20 seconds, and increase in increments that are small enough so you can hold the exercise for the whole 2 minutes. Hamstring tightness is very common around arthritic knees, particularly in people who've had large deformities corrected. So if your knees were bent and bowed, your hamstrings will be tighter after the surgery than they were before it. Now tight hamstrings profoundly affect the gait pattern and can cause a recurrence of the deformity, disturb sleep, and the sooner you get them stretched, the better you're going to walk. This exercise is done with the knee resting over a bolster to take tension off the sciatic nerve and the knee itself. Tension is put on the hamstrings by tilting forward at the pelvis, not bending at the back. So the hands go down onto the leg, tilt forward at the hips, hold for 20 seconds and then go a bit further. Hold for 20 seconds, then go a bit further, and this is done for 2 minutes on each leg. Now the number one cause of someone being unhappy with a knee replacement is stiffness. I've spoken of the importance of keeping swelling down so these exercises can be done effectively. And the key is to do this exercise every time you get off a bed, off a chair, off a toilet. And so most of your exercising, as far as getting the knee bending, is done in the movements you'll naturally do around the house, and very little time has to be quarantined out of bed to actually get the knee bending. It's very important you start this exercise in hospital and continue it until your knee's flexing as far as possible. Don't find reasons not to do it. Don't be worried about the wound popping open. Don't be worried about tension or pain over the front of the knee doing damage. It's important to do it and do it. So while you're in a seated position, get one leg in front of the other, pull it back until there's tension over the front of the leg, and hold it there for 20 seconds. After 20 seconds, pull it a little bit further, once again till there's tension, and hold it there. After 20 seconds, pull it back a little bit further again. The whole idea is to get the feet back under the chair and the knees bent so you can get your weight over it when you stand up. Now you must use your knees when going from a sit to stand and stand to sit. Not once, not ever, not on the first day after surgery should you avoid using the knees to get out of a chair. The whole idea is to do the progressive stretch exercise you just saw to get the feet underneath the chair so your centre of gravity can be placed over the feet and you get in and out of a chair properly. Now this is the way not to do it. He doesn't have the feet under the chair and his centre of gravity isn't centred over the feet, and he's fudging the feet forward getting into the chair. This is the way to do it properly. He leans forward so his weight's over the knees and the legs push him out of the chair, and then when he comes back in, he doesn't fudge the feet forward, they stay against the chair, and he uses his knees to lower himself into the chair. A bike's an incredibly effective way of getting knees bending after a knee replacement. It requires no active force from the knee you're trying to bend, and the pedals give enormous mechanical advantage to the other leg that's actually doing the work. I stress it's not training for the Tour de France. You absolutely do not want your knee spinning 1,000 times a day, as it'll simply cause swelling to get out of control. If you find you can get the knee the whole way around the arc of the pedal, then move the chair closer to the pedals so you have to bend it further to get it around. Do not spin the knee around hundreds of times. It will just cause swelling to be a problem. So the leg on the front's doing the work. The leg on the back is the passenger and the one that's being made to bend. We employ the 20-second stretch and then hold, and then progress a little bit further. Hold it for 20 seconds, push forward a little bit further, hold for 20 seconds. Then reverse so that the other leg's getting stretched, and do the same process. Hold for 20 seconds and then move a little bit further. Hold for 20 seconds and then move a little bit further, and keep going until you can get the leg around, then move the seat close. Now I've left gait pattern till last because it's the thing I really want you to remember. This is what ties everything together, and this is what you're actually trying to be able to do properly at the end of the knee replacement. It's very, very important to practice the right thing and not the wrong thing. If you've been walking with a reasonably normal gait pattern before your replacement, you'll just go straight back into that pattern and it'll be quick and simple. Many of you will have been walking with stiff knee patterns, with terrible limps, tight hamstrings, and you will have to actively think of doing the correct thing with every step until you've got it right. I stress we're not after speed, we're not after distance, we're not after large steps. We're after quality and practicing the right thing. Remember that practicing the wrong thing is worse than not practicing at all. This is what not to do. His head's down, his hips are flexed, his knees are flexed. They're not straightening when the foot hits the ground, and they're not bending when the foot leaves the ground. It's doing him no good whatsoever. This is correct. His head's up, his hips are straight, his knees are straight when the foot hits the ground, his knees are bent when the foot leaves the ground. Here's a nice, even, progressive pattern. This is it again. Up straight, knees are straight when the foot hits the ground, knees are bent when the foot leaves the ground. It's flowing and even. This is it again. Toe up, heel down, and knee straight when the foot hits the ground. And heel up, toe down, and knee bent when the foot leaves the ground. He has a nice, even, flowing gait. So straight after a knee replacement, it'll take hundreds of steps a day, and if you walk like this, your knees will start bending easily.